Good day, future doctors and medical technologies. Welcome back again to another episode of HIS Lecture with Mr. Neil, and I'll be your professor for today. So today we're going to talk about the last topic in midterms. We have the hospital information system. Do not be confused with health information system, health information technology. Okay, so this topic will really focus more on the hospital information system. Since system siya, it will be a composition of lots of integrated areas. Okay, so this is primarily used in the hospital. Okay, so this will be the learning outcomes for today's topic. Okay, so let's start. HIS, or your Hospital Information System, is a system that assists in the maintenance of an institution's record. Remember, guys, that healthcare plays a vital role in a society, and people expect efficient from healthcare providers and health institutions, which face the challenge of handling the numerous patients that seeks their services. So it means that since we have lots of patients in a hospital, okay, you need a system that will keep track or maintain all the records in that particular hospital. So proper management of clinical and operational records is therefore necessary. At present, most hospitals have shifted to from tedious manual recording, from that old times na manually pa siya sinusulat or ginagather, tinatago ang mga data, okay? To the use of HIS, or your Hospital Information System, to assist, okay, the institution in maintaining the different records. Okay, so let's start with a brief background of what is an hospital information system. Hospital information system is a computer system introduced in the 1960s, remember, that is structured to manage, okay, the keyword there is to manage all records of the healthcare providers, makes information and reports available for healthcare personnel to use and perform their jobs more efficiently. Obviously, if the healthcare personnel can have a access on your personal data, as the patient po, it would be easier for us or the doctors to make accurate diagnosis, and will be able to compare it from your previous results. Okay, so back then, features of HIS were used mainly for billing lang. Okay, back then it is mainly used for billing and inventory. But nowadays, okay, everything changed through time. Today's system is also integrated with other financial, scientific, and administrative program. Okay, so since modern naman ta, we will talk about the modern HIS. A modern HIS, okay, remember, has applications built to address the needs of the various departments of the health facilities, such as the nursing, the pharmacy, the finance, radiology, and pathology. So remember po that the laboratory department is under the pathology. Okay? So there are hospitals with as many as 200 disparate systems integrated to their HIS. So remember, guys, since this is a system, marami po siyang components. Okay? So ibig sabihin, the nursing department, the finance department, the pathology department, all have their own HIS, and it is all integrated in a one system lang po. Okay, but tandaan po natin that the admin HIS is quite different from the nurses, the nursing department's HIS, as well as the pathologist HIS. Magkakaiba po yun. For example, tayo sa laboratory, ang ating HIS, we are able to encode results, laboratory results, whereas the nursing department cannot. They can view the result, but they cannot encode, okay, or edit the results. Okay, magkaiba po yun. The admin naman is quite different. Then they can manage the healthcare personal's HIS, but they cannot, okay, once again, edit the result kasi hindi limited po yung function nila. So their HIS, remember that the HIS will be tailored to what department you are under. Okay, so remember po, hospital using the HIS experience efficiency in accessing reliable patient information with just few clicks. Okay, however, advancements and developments will be rendered useless if the system is not user friendly and the training is inadequate. So therefore, usually guys, ang HIS should be dapat ideally taught no in the earlier days sa college, para at least when you do join the workforce puhon mas easier na lang sa inyo ha. Unlike us before na we learned HIS no yung time na nag-work na kami, so nangapa jud mi guys. Okay, so let's talk about on how an HIS to be effective, no, what the things that it needs to be. For an HIS to be effective, it needs to be affordable, scalable, and centered on the needs of the patients and the medical personnel. It should be adaptable to rapid technological changes and provides enhanced integrity of the facts, no? It should be able to minimize transcription error and duplication of records, and should have a shorter report turnaround time. Obviously, after natin ma-input ang result, automatically guys, mabibview na yan siya ng mga physicians, ng mga doctors sa ER. Yes, okay. By the way, turnaround times, no? Turnaround time refers to the amount of time taken to fulfill a task or request. Remember, HIS available today links computer that are capable of quickly optimizing operations and delivering quality service. The systems gathers, process, retrieve patient information, and provide hospital stakeholders with relevant information through reports for better decision making. Remember din guys, since nabanggit po na scalable siya, no? Scalable, HIS needs to be scalable. Scalable means able to climb or measured or grade something. So ibig sabihin, in the HIS you can also view na, for example, for this particular patient's result, you can still view na unsa iyang previous result, then you can make a graph of that particular result, nga na siya. So HIS is very modern in a sense because it can do those things ngayon na time, but before lisod jud guys, dili siya feasible. Okay, so remember din that since you already know that what the HIS needs to be para maging effective, anong implication ngayon if effective inyong HIS? So, an effective HIS guarantees the following. Okay? So, the system guarantees delivery of information required by healthcare personnel because of the optimized core library. It can also be customized to consider the particular needs of the department and centralize them into the system. Remember din that an effective HIS will guarantee responsive, no, to the requirements for the solutions set by the hospital or institution. However, a hospital should provide the requirements in detail to the HIS provider during the initial stages of scoping so that its needs will be met and accurately provided. So obviously guys, no, it took some time before the HIS to be effective, because remember guys, ang HIS manggod is a system developed by certain companies. So lahi-lahi ang HIS per hospital po, no? Some uses ganito nga HIS, integrated na lahat-lahat, no? So from ganito na company. Some naman uses this one from another company. So lahi-lahi siya, but their aim, okay, yung aim nila is the same, since isa man siya na system, no? Hospital information system. So ibig sabihin, despite having different companies offering HIS, no, their goal and their what they brings to the table is similar po in a sense, no? Meron na sigurong content changes or pagkakaiba-iba, pero halos the same lang na sila guys. Okay? So, remember po that if you have a HIS, no, effective HIS, you will have a centralized information. When you say centralized, it means concentrated, okay? Unified yung information, okay? So, ibig sabihin, from si patient X, lahat ng information ni patient X, okay, mag-gather siya in one place. So, the doctor can view all the laboratory result, no, encoded by the medtech. Okay, the doctor can also see what are the medicines purchased or taken from the pharmacy, no? Makita po ng doctor kung sa mga gi-administer sa nurses. Yes. Okay, yan yung benefit ng HIS natin. Okay? So I told you before that HIS is a system, so it means it has lots of components. So isa-isahin natin ang mga component or mga HIS for different systems. So meron tayong at least minimum of 4 component. Okay, so let's see. No, let's start with the NIS, or the Nursing Information Systems. The NIS, or your Nursing Information System, is developed to enhance patient care by providing nurses with accurate information to assist them in performing their duties efficiently. So, ibig sabihin, the nurses will be able to see the initial impression, no, during the time na before nagpa-ER si patient, no, makikita yan ng mga nurses. And then, they will be able to see kung unsa tong mga restrictions or the things na bawal kay patient, para when they do their job, no, in the nursing care, no, ma-avoid nila yun. For example, nakita nila dito na patient is allergic sa ganitong pagkain. So, ibig sabihin, during the time na hatag na sila ng mga pagkain or gamot, paiiwasan nila yun, which will make the patient better over time. Another thing that the NIS offer is that one of its functions, by the way, handling of personal schedules, accurate patient charting, and better clinical data integration. So remember po, sa NIS, mga good guys, ng mga nurses, they will be able to see, okay, makita nila yung mga pag-clock in, clock out ng mga nurses. So, ibig sabihin, they can manage, no, the time in or overtimes or absence ng isang staff. Your NIS po, since sa isang hospital, most likely ang pinakamaraming personnel dyan would be the nurses po. Okay? Kasi sila man yung directly taking care of the sick patient, diba? So, ibig sabihin, mas madami talaga sila. So, remember that agenda packages help enhance the management of workforce by helping the managers. So, mga nurses po, guys, meron yung sila mga nursing managers. So, mga managers yan, guys, sila yung mga head ng mga nurses pwede siya per floor, per ward, So, helping the managers handle overtime and absences, obtain cost-effective staffing, and show the staffing level. So, they will be able to see if this ward has enough nurses that will be able to cater yung mga patient or not. If kulang, they'll be able to, add more or bawasan nila, transfer nila sa mga ward na mas nangangailangan talaga. Patient charting application allows better analysis of the critical signs, obviously. Okay, the nurses could check admission information and care plans along with applicable nursing notes, no? Crucial information is kept and can be retrieved when needed. Also useful in designing the patient's care plan, since the medical information integration functions allow nurses to collect and examine, retrieve medical records. So obviously, guys, it is very beneficial for the nurses to have an HIS, on their own. But remember, since nurses man to, they cannot input laboratory results. They can view, they can view the laboratory result, but they cannot input it. Okay? What they will be able to do is pwede lang dyan nila makita ang mga result, and then they can make a nursing care plan in accordance sa results na gisend natin, or depende sa interpretation ng physician. Okay? Kasi meron tayong tinatawag na RODs, mga nag-rotate ng mga doctors. Okay? So, ibig sabihin sila yung mga pumupunta sa mga ward, tine-check na yung chart ni ganito, magbibigay sila ng mga gamot, and other care plan. So, si nurses, i-input yan lahat niya sa HIS nila. Okay? Another in relation with the nurses, is your Physician Information System, or the PIS. The Physician Information System is the system designed to improve the practice of physicians, deployed and extensively used in your EMRs and EHRs, electronic medical records and electronic health records. Most systems offers 24/7 to facilitate easier usage of the system. So, ibig sabihin, guys, the physician, since the doctor's time is as valuable as the patient, dapat accessible sa mga doctors or sa physician ang mga data ng mga patient na ginahandle nila, para anytime, if they input something na, let's say, administer this at ganitong oras, the nurses will be able to see it, and therefore they can administer the medication, and if ever naman na ay na-observe si nurses on their end sa bedside, since sila man yung nandun, they can input kung ano yung nakita nila, and then the physician can make follow up, or kanang additional inputs or kanang mga follow-up medications sa kung unsa man ang na-observe sa mga nurses. So this is a two-way, no, kanang helpful po siya sa part sa physician. Same thing sa laboratory din, when we upload critical value results, na makita yan ng physician sa HIS, and then they can make, yes po, medications or administer medication based on the critical value that we have reported. Okay, so let's talk about the next one, which is the RIS. RIS, or the Radiology Information System. It is a network software system for managing medical imagery and associated data, capable of providing billing services and appointment schedules. Remember, maalala pa si PACS and VNA, used in conjunction with PACS and VNA for reporting and database storage. So, ibig sabihin, all the images, no, done in the X-ray department during the time na nagpa-X-ray ka will be integrated in the RIS, no. Malagay doon yung mga images, no. These are digital images, by the way, radiologic images po, and they are converted into VNA, no, from PACS to VNA, because VNA is a much standardized format. Okay, so ma-view yan. So after ni RadTech ang mga X-ray, ma-view na yan agad ni radiologist or yung physician po, no, sa X-ray department. So makita niya yan sa HIS niya kung ano yung yung X-ray result, and then he can make the interpretation now. So ibig sabihin, ma-interpret niya ang result, and then pwede niya na malagay doon agad. Okay, so from the HIS itself, they can also print out the actual result of the patient. Okay, the actual result of the patient, and then doon ay i-claim ni patient ang result sa X-ray department. Remember din that in the RIS, no, since X-ray needs to have a kanang scheduling, kasi nga one at a time lang jud ang sa X-ray, no, kasi minsan isa lang X-ray machine, so need jud magpakaroon ng appointment schedule. So the HIS po is capable of providing billing services and appointment schedule. Okay, so let's move to the last, HIS na department aside from your laboratory, the Pharmacy Information System. The Pharmacy Information System helps monitor the utilization of medicines, obviously, in health institution. It also handles information and medication-related complications, drug allergies of the patient, and provides information to identify the drug interactions for patient's prescription. So obviously in the pharmacy na HIS po, no, it's quite different from the laboratory. Okay, kasi nga sa pharmacy po, they will be the ones, no, who will be encoding kung ano yung mga nakuha or request, no, ng mga doctors for their patients. So ibig sabihin, let's say for example, the doctor requested for a 7 days worth of antibiotic 3 times a day. So ibig sabihin, si pharmacy po ang ang i-encode niya sa HIS para at least during the billing, no, makita na merong nakuha na antibiotic si patient natin. The same time, there are some, hindi lang po doon limited sa mga gamot po sa mga antibiotics lang. There are some gamot po kasi or some medication that requires the pharmacist knowledge, no, in measuring or making the appropriate dosage po sa hinihingi ni doc. Okay, so meron po yung dyan. So lahat po yun nilalagay ni pharmacy. At the same time, if makita nila yung notes from the physician or sa nurses po na HIS, no, may nakita na allergic siya sa, let's say, paracetamol. So the pharmacist, no, when they're going to make a certain medication or drug, no, they will try to avoid all those medications na allergic si patient. Yes, okay? And that way, no, the patient will get better over time, no? Walang complication na mangyayari. Kasi nga, aware si pharmacy department, and then ma-sure na tama po yung mga ginagawa. Okay? So, since we already know the different HIS departments, let's talk about the HIS selection criteria. No? These are aspects that needed to be considered in selecting your hospital information system. Gaya na sinabi ko, we have lots of HIS, no, na providers. So let's see. So the following are the aspects needed to be considered in selecting your HIS. Okay? Mura na jugni ka ng choose your fighter. Yan. Okay? So you need to consider the total cost of the package, web-based system and implement and support. So the total cost of package available for all for hospitals in all sizes and budget. Reduce upfront and maintenance fees for those smaller budgets. We also have web-based system. Authorized personnel can have access anytime and anywhere. Ito na yung parang online po siya, no, na parang si outside the hospital, you can access the HIS. Okay? We also have the implement and support providers, ample training and assistance of the user of the system, and offers 24/7 support through the telephone or web services. So, again, itong tatlo, this would be the criteria. So once again, an HIS, no, does not need to have all three. Okay? So there are certain HIS that I have used in the past po na hindi lahat itong tatlo meron, but effective naman siya. Okay? So sinabi lang dito, these are the things that need, no, to be considered in selecting your HIS information. Okay? So it might be again, it does not have to be 3, okay? Two or more guro, no? Okay na. Okay, so let's see what are the top Philippine HIS providers. Okay, so once again, HIS providers, integrated healthcare technology that connects institutions and providers. So remember po, when you talk about integrated healthcare technology, okay, the HIS and clinical systems, no, will be connected. Okay, will be connected. So ibig sabihin, the hospital, clinics, and doctors will be connected to other healthcare providers. So let's see kung sino-sino to sila. Okay, we have at least 3, no? So let's start with the BizBox Incorporated. So BizBox was founded 25 years ago with its very first hospital project completed in 1994. The goal of the company daw is to improve work efficiency in healthcare institution through software systems to produce advanced solutions for better patient care. So ako guys, personally, I have used the BizBox po. Okay? So out of the 3, out of the 3 po na aspect na need natin i-consider, the BizBox po is meron siyang ito and meron siyang ito. The BizBox does not offer for me based on what I have, yung nagamit ko. We don't have a web-based po na system kasi nga we will not be able to access the HIS outside the company. Okay, outside the institution, outside the hospital. Okay, and it would really make sense, no? Kasi nga for me as a medtech, kasi since laboratory lang naman tayo, I don't know if the doctors were able to access them as baka iba yung sa HIS nila since lahi-lahi man tag HIS per department, diba? But for the laboratory po sa amin is that we are not able to access the HIS outside of the hospital. Yung sa internet, ganun, hindi po. Okay? Because the rationale behind sa na-experience namin is that after ng shift mo, dapat wala ka nang problemahin, no? Dili na nimo pwede ka nang pwede or allowed na i-edit ang result na na-release na nimo kaninang umaga or kagabi. And baka mas magkamali ka pa, no, kay kung mapindot-pindot mo ganun. So sa amin, ang BizBox sa amin sa laboratory, once again for the laboratory po, I'm only speaking for the lab. Okay, we were not able to do the web-based. Okay, so nice siya guys, because as you can see here, okay, as you can see here po, you can, if you're going to click the inpatient, these are all, okay, itong lahat na naka-highlight dito are all inpatient po. Okay, so saan sila? This, by the way, is an example of not an laboratory na HIS, no, but rather a nursing po na HIS, because you can see saang nurse station siya na assign. Okay, as well as anong bed number po siya. You can see the bed number, kailan siya na admit, okay, admission date and time, and then sino yung patient natin, and then gina-categorize din siya whether the patient is old, new patient, okay, old or new. So ito po, kung titignan niyo dito na side, these are the summaries po. When you talk about kanang active, ibig sabihin they are currently inside the hospital, no? They are currently inside the ward, something like that. For the discharge, ito po yung mga recently lang na discharge, okay, na mga patient. And then meron tayong mga for MGH, when you talk about MGH, it refers to may go home. Ibig sabihin, merong isa na nag-process pa na para ma-discharge siya, para makaalis siya. And then meron tayong isa na na-clear na. Okay? So ibig sabihin, ito yung mga na-discharge siguro for the past day, kung ilan yung length po ng day na giset mo. Let's say for example, you wanted to see the patient from Monday to Saturday. Okay, for that week, ito na siya most likely. Okay, ito yung recently na clear. And then, meron din, makikita nito yung mga patient na hindi na nagtuloy sa hospital natin. And then, may makita rin dito yung mga patient na namatay. Okay, so this is the VISBox po. I have used this intensively before. Okay, so I can vouch that this is a good HIS po. Okay, so let's check the next one kasi tatlo to sila no? So we have the KCCI MedSys. Let's check. So the Kaiser de la Cruz Consulting Incorporated specializes in application developments for hospitals, clinics, and medical related institutions in the Philippines. Company products that provide proven solutions, no? We have Duha, no? Visual MedSys for the hospital, Medsco for schools. So let's see yung MedSys natin. Ito ang MedSys natin, I've used this before during siguro training po na time, but still same nagyapo ni siya og function. Okay, why? Because you can see, no, the entire patient information, no? You can see the patient ID, the patient name, okay, the type of patient, the birthday, and other things, no? Meron din tayong mga religion, guardian. Okay, anong napansin po natin dito? Since this is a tawag yan not a laboratory, no, 'di ba? Laboratory na HIS, no, laboratory information system. As you can see, wala pong mga result nakalagay. Nor, okay, wala pong mga nakalagay po na ano po na mga saang yan, mga information related po sa kanyang health record. Okay, so it depends po talaga kung ano yung HIS na currently ginagamit, and this one uses the web-based po, web-based yung sa pangalawa, because of the Microsoft Internet Explorer. So sabihin makita po siya online, so pwede po siya makita online provided that you have the username and password. Okay, gaya ng sinabi ko guys, no, it does not have to be itong exact tatlo, 2 or more, pwede na po talaga siya, no, 2 to 3 pwede po siya. Okay, so let's talk about the last one, the Logic. Okay, so ComLogic Business Systems is a Philippine-based development company established in 1999 with a vision to be global technology company leading the way for innovative applications anywhere, anytime. Provide online, no? Keyword online hospital services. So let's try to check po, okay? Okay, itong ComLogic po guys, as you can see, no, since online man siya, no, the ComLogic led the way in developing innovative applications like online hospital services in which patients can see or access their billings and examination results online, while the administrators can access reports and doctors can access the patient's record anytime and anywhere. So, ibig sabihin, this is also a web-based po. Okay? So, web-based siya, ibig sabihin guys, no, ma-access ng patient yung kanyang mismong billing and examination results, while the doctors, yung kanyang mismong doctor, makikita po yung result niya. Sadly, we cannot zoom in anymore na dili na ito mabasa yung data, but as you can see, no, you can see the name here, okay, and other informations po here, no, like for example, the Roman Catholic, Filipino, ingana. And then, kung meron siya mga result po, no, you're going to click yung mga different na areas. For example, meron tayong nursing surveys here. We have the other reports here sa taas, no. So, ibig sabihin, this is very convenient in a sense po that the patient will be able to see yung result niya if done na na-process sa laboratory or sa x-ray. Kasi di ba minsan ang x-ray kay tomorrow pang result. So you can view, at least you can view it online. Okay? So let's move on sa next slide. So we're ready to talk about the three, no? The VISBox, the KCCI, MedSys, as well as itong ComLogic natin. So, kayo na lang pili kung ano yung gusto ninyo, but I hope you understand that the HIS po is a system. They all have the same components, pero yung meron ng slight difference, like for example, yung isa, pwede siya online, yung isa, hindi. Okay, so let's talk about the functions of HIS. Okay, so I've told you before, no, what is the meaning of HIS or the Hospital Information System, unsa siya, nganong system siya. So now we're going to talk about the functions of your HIS. Okay, so these are the functions po, isa-isay natin yan siya. Okay, so we have the help desk, scheduling, and patient registration. I know you, it is very understandable kung sa ang meaning nilang tatlo, no? Actually, madami-dami pa yan sila. Okay? But itong tatlo ngayon, very understandable siya. So let's try to uh, check, no? Help desk, no? It is the manual retrieval of information. Okay? Manual retrieval of information. So, clients are provided with information and guidelines with the company's products and services without any hassle. So, ibig sabihin, the HIS po will be able to cater those patients or kanang mga clients with lots of questions. Okay? So, scheduling, the managers and employees can access work schedules anywhere they are and discuss scheduling preferences. Obviously, this is the function of yung ating laboratory managers na kung in terms of laboratory. And then also patient registration, no? It records relevant informations about the patient and use the records. Okay? Use the record keeping and account management po na part. So, this form is usually filled out during the patient's visit or consultation, but if the patient is unable to complete the form due to the need for prompt medical attention, the form can be filled out by a guardian or relative. Okay? So, ibig sabihin, isa po ito sa mga function ng ating HIS. Sa patient registration pa lang, very understandable, no? This is the time, no, na lalo na kung new yung patient natin, they really need to put their record po para magsali na sila sa sa ating HIS. Okay, so let's try to check other functions of your HIS. We have the admission, discharge, and transfer. So, admission, before a patient is admitted to health facility, an admissions counselor will call him or her to gather preliminary information, offer vital information concerning the hospital stay, and answer questions if there are any. So, additionally, the physician may also schedule a recurring medical exam such as laboratory tests for x-rays before hospitalization. Other routine tests can be carried out on the day of the admission. All these can be done more efficiently through the HIS. So usually guys, no, if the patient will be admitted in a certain hospital, tatawag man talaga yan sila, no? Tatawag sila na if may vacant ba ang hospital na yan, no? Ano ba ang vacant na room for the moment. Then the same time, if meron vacant and then if they really want to go to that particular hospital, the admission counselor, the admitting officer, no, will talk to the patient or the watcher or the guardian of the patient. And will ask relevant information, no? Para at least, pagdating nila sa hospital, the transition will be much easier. Okay? And obviously, if there is admission, there is also a discharge, no? So, discharge through the HIS, instructions that accompanies a patient's discharge or transfer are efficiently provided. So, ibig sabihin guys, dito pa lang sa discharge, no, ililista lahat ng mga doctors kung ano yung mga, let's say for example, things to do ni patient within this week. Yung mga, meron pa bang mga, hindi naman huling habilin, no? Meron pa bang mga notes ang physician or mga, let's say for example, medication na dapat niya tapusin but pwede na siyang ma-discharge, no? Pwede na tapusin sa bahay na lang. So, lahat yun guys, no, will be input in the HIS and can be printed out and given to the patient. Okay, so these instructions may include discharge planning, which details services needed to be administered after the hospital stay to ensure that the full recovery of the patient will be achieved. So, if the patient naman, no, if the hospital cannot, let's say for example, sustain or cannot meet yung need ng patient, for example, the patient need a much higher level of care that the hospital cannot provide. Let's say for example, the hospital is only accredited level 2. And then yung care ni patient, it should be on a level 3 or more, no? The transfer will be, will be put in place, okay? Usually, you can observe this sa yung mga hospital na primary lang, then nagpa-try kayo, admit, okay? During the transfer, yes po, the transfer, tawag yan, will be the movement of person outside the hospital premises via the authorized personal instruction. Okay, must have requirements for a proper switch. Okay? So, remember po, tawag yan, ang transfer will only be applicable if, tawag yan, if meron po tayong mga requirements na procure kanang yung proper talaga, no? Kasi what if nag-antibiotic niya dito si patient tapos pag-transfer niya administer naman siya ng another set of antibiotics, so that would be a no-no. So the patient, okay, will need to have a copy yung kaniyang mga prescription or whatnot. Okay, yun yung mga requirements po dito na ginasabi. Okay, yung mga details, mga notes ni doctor. Okay, so remember po, the transfer does not however encompass movement of the individuals who, letter A, been declared lifeless, letter B, leaves the facility without the permission of such authorized personnel. If the patient is transferred from the ER, employees must fulfill a statutory requirements for a proper switch. Okay? With the HIS, the patient transfer details are easily accessed and processed. Yun yung ginagawa ng HIS eh. Dili na need o ka ng mga documents na manuot if mawala pa. Nga na. So, since sa HIS naman siya, they can encode it and then print it after. No? They can also kanang send it online if web-based yung ginagamit nila na HIS. Okay? So, let's check another function ng HIS. Okay, so another function of HIS would be the billing, contract management, package deal designer. Okay? So, sa billing, it shows all, very understandable, no? Shows all records pertaining to the invoices, payments, and the current or overdue balance of the patient's account. For the contract management naman, okay, contract management, process of managing the contract creation, execution, and analysis to maximize the operational and financial performance of an organization. Ang package deal designer naman, post-diagnostic medical packages for inpatients, outpatients, and emergencies without the hassle paperwork. So I'm going to explain this to you, so I hope you will listen to me. Okay, so billing, dili na ko siya explain because very understandable naman siya, no? So, billing shows all records pertaining to the payments, invoices, and the current balance of the patient's account. HIS is very useful for patients who require frequent healthcare services because numerous invoices can be combined in and a lump sum payment can be made. It is good to practice to generate the billing statement on a regular basis so that the institution could keep track of its collectibles. HIS lists the outstanding balances of the patient. Any overdue payments will be checked easily. In addition, balances of the patients who only have minimal transaction are kept updated. So, ibig sabihin guys, no, sa billing, lalo na kung ikaw isang patient na recurring parati or lagi kang ma-hospital, no, the billing there will be able, the billing function of the HIS will be able to keep track, no, na isahan lang lahat ng bills mo. Okay, kahit na kasi minsan kasi yung reason bakit tayo na-hospital, for example, the patient is requiring frequent na dialysis. So, ibig sabihin, pag may dialysis, minsan nag-require po yan ng mga abonuhan ng dugo, ganitong kadaming bags, no? So, ibig sabihin, kung frequent na siya, in 1 week, at least twice a week ka magpa-dialysis, or once a week, so ibig sabihin, lagi ka talaga sa hospital. It would be very beneficial if the entire invoice nimo for the entire month, no, will be kept in one area lang. So, yun yung function ng HIS ninyo. Okay? So, ang inyuhang contract management, no? So, according kay Goodrich daw, defines contract management as the process of managing contract creation, execution, and analysis to maximize the operational and financial performance of an organization while reducing financial risk. So, ibig sabihin, you can this is a function of the HIS, no, that can monitor yung sa na to siya guys, sa kanang murag financial aspect na ng institution ninyo. Organizations constantly encounter pressure to reduce the cost and improve company performance. Contract management proves to be a very, very time-consuming element of business which facilitates the need for an effective and automated contract management system. So, for example, no? Ayan. When the contract management is successfully implemented, no? Realization of expected business and financial returns, cooperation and responsiveness of the supplier to the organization's needs, no contract dispute or surprises, satisfactory delivery of services to both parties. Ibig sabihin guys, no, kapag meron kang contract management, ito siya na system, part na function ng HIS, you will be able to see all of these things, no? Makikita mo na, na-deliver ba lahat ng services sa both sa patient and sa institution, no? Meron bang cooperate, responsive ba, wala bang delay, ingana siya. Okay? So, for the package deal designer naman, this is where the posting of diagnostic medical packages for inpatient, outpatients, and emergencies require the same process. The difference is that for emergencies, this is called post-diagnostic package deal. Okay? HIS helps in accessing information regarding the package deals without going through the hassle of paperwork. So, ibig sabihin sa HIS po guys, no? For example, outpatient, usually, makikita po pag outpatient, for example, ang main concern na lang talaga ni patient is that ang liver niya. So, the HIS can have a liver panel. Ano pa mga pwedeng test to check for kanang sa effectivity ng liver. Pwede po dyan kanang sa imaging, no? Sa radiologic department to check mismo yung liver nila through kanang mga radiologic imaging. Pwede po yun. Okay, so ibig sabihin, these are package deal po. The HIS, you can design your own package deal po. Ibig sabihin, tawag yan, you can design your own package deal. Ibig sabihin, pwede ka you can cater much more daghan na mga tao depending on what their needs na. For example, heart problem ng isang patient. No, you can offer monitoring ng kanyang AST, mga heart enzymes, ingana na mga butang. So, it would much be easier. Kaya nakapackage naman siya. Pagpasok sa outpatient, mga tanong sila, okay, unsa tong mga ano ninyo, presyo, unsa tong mga test for ganito. So, i-click lang ni, let's say, ni information, makita na ngayon ng patient na, okay, so gusto ko to. So, click lang, then tuloy-tuloy na siya, guys. Okay? So, yan yung kinaganda sa package deal designer. Okay? So, tandaan, same lang na sila na process for inpatient, outpatient, and emergencies. However, sa emergency, ang tawag po sa kanya is post-diagnostic package deal. Okay, so let's talk about other systems of reporting and data management. Okay, other system, we have different reporting. For example, the laboratory, radiology, cardiology, reporting. Okay, so I'll be explaining to you the results or meaning or unsa ang dapat na adira. Okay, so let's see. Okay, so laboratory reporting, remember guys that despite the differences in presentation and form, lahi-lahi jud ang nawong sa laboratory result, di ba? All laboratory reports must possess common elements to aid in the interpretation of the result, no? So, common elements as required by institutional and company policies. They may also contain supplementary items not specifically required, but which the laboratory chooses to report to aid the interpretation of results, no, of medical testing. For identification and filling purposes, some laboratory reports display elements with administrative or clerical information such as the following: your patient's name, no, identification number, unique patient identifier, okay, name and address of the laboratory location where the test was performed, date where the test was printed, test date, test report data, name of the doctor. Okay? So, pwede rin include po dyan yung ating mga specimen or lab test informations. Okay? That includes the test result, critical results, abnormal results, interpretation, name of test performed, measurement unit. So, actually, all of this data po, guys, no, is common to all laboratories. For example, this example of a result, no, na view niya online, obviously, kasi, naka-PDF. Okay, so you have the test here, you have the patient's result here, the patient's details here, nag-blurred out, and then, the unit of measurement used, okay, and then the range of value. Okay, so actually guys, itong unit po, it differs, depende po yan sa type ng analyte, okay, and other doctors also prefer other unit compare sa other, kasi meron tayong tinatawag na conventional unit, and the SI unit. Yan sila po yung mga most common units in the laboratory reporting po. And pagdating nyo ng clinical chemistry, puhon, no, mamit na ninyo sila, daghan kain na sila, guys. Okay? So, these are all clinical chem na mga result, no? Urea, CREA, uric acid, sodium. So, clinical chem na test, and these are the results niya. Okay? So, gina-provide din somehow ang range value, and merong ibang laboratory po na ginalagyan nila ng critical value. If critical, for example, we have the blood urea niya, 10 to 50 ang range. So, pasok sa normal range. However, ang kanyang CREA is 20. Okay? While the normal range is 0.6 to 1.4. So, ibig sabihin, critical value. So, pwede, merong ibang laboratory, guys, no? Hindi lahat, pero merong iba, merong sign dito sa gilid niyang arrow up. Ibig sabihin, mataas, no? Or minsan, ganit, tatlong arrow, ibig sabihin, mataas na mataas talaga. Okay? So, meron din siyang result po dito na since mataas ang CREA niya, no? The uric acid is also high. Okay, 32, then 2.5 to 7. Sodium niya, masyadong mababa. Potassium niya, masyadong mataas. Kamatyo na ng pasyente. So, anyways, no, as you can see, the result of the patient or yung component ng reporting po, the laboratory reporting result, no, may differ, the design may vary from each other, but still they all have common elements po to aid. So, huwag kalimutan, meron tayong dalawang category, the identification or the filing purposes, and then the specimen or lab test information. Okay? So, I hope huwag natin kakalimutan yan. So, I hope familiar naman siguro kayo sa nawong sa laboratory result, no? So, kung meron kayong copy, try ninyo tignan kung nandun ba yun, yung mga elements na sinabi ko. Okay, so let's proceed to the next reporting. The radiology reporting. So remember, an official medical document that provides details, no, whether positive, negative, important, and incidental findings of a requested radiology examination. So these are the pictures po, no, as you can see, different formats for different computers. So ibig sabihin, most likely VNA na ni siya na format kasi yun yung standardized. Okay? So, tandaan po natin that this is according to the University of Virginia. A radiology report is an official medical document that provides details of requested radiology examination and procedure conducted by a radiologist. Okay? A qualified physician authorized by healthcare institution interprets the result. Ang nag-interpret ng result for X-ray, radiologist po ang tawag doon. Ang nag-perform is a RadTech, radiologic technologist. Okay? The main objective of the report is to address the queries in the request. So, sometimes when you ask for a chest X-ray, obviously, chest X-ray jud siya. Chest dapat ang i-X-ray sa'yo. Okay? So, hindi pwede tiil, hindi pwede ka ng other limbs ni mo. Okay, so the findings in the report should take into account both positive and negative findings. Important findings should be stated followed by incidental finding. The basic sections of radiology reported, must include administrative information, patient identification, clinical history, the imaging technique used, comparison, observation, summary, or impression. So, ang pinaka-importante dito guys is kani silang tanan. However, dapat daw included po to. Summary or information. Nakatry na kayo magpa-X-ray and then somehow, ang nakalagay sa pinakababa ng result niya is lungs are unremarkable. So, ibig sabihin, or no remarkable findings ang nakalagay. Ibig sabihin, guys, no, yun yung kanilang summary or interpretation. Ibig sabihin, normal ang X-ray mo. Sometimes po, kana makita nila kung nagpa-chest X-ray ka, makita rin nila if the heart is enlarged by ganito ganyan, no? Pero overall, at the end of the day, ingon na nila na heart is enlarged, lungs is ganito ganyan. However, maghatag jud na sila og kanilang summary or impression. I hope klaro po yan siya ha. So, nandun po yung positive, negative, no, na mga findings nila, dapat kasali po yan, whether positive or negative. Okay? So, we also have the cardiology reporting. Okay? So, sa cardiology report, like other laboratory reports, contains important information based on the test results of the patients, which are set against past medical records. Doctors are able to write vascular reports much faster since access and retrieval information are made much more convenient through the computer system. Obviously, this is very true because dati guys, no, manually jud siya ginasulat ng mga doctors and then dalahon jud na nimo. Like for example, my dad was always sa Cotabato City nagpapa-check and taga-probinsya kami. So, every month nagapunta kami sa Cotabato and then dala-dala namin yung previous result niya. What if nawala namin? Ganun. Whereas now, we have the HIS, thank God, no, may record na sila doctor doon. Okay? So, using cardiology information system, no, vascular sonography reports are accurately created with only a few clicks. Informations on these reports could include ultrasonic or ultrasound and diagrams. Nowadays, physicians opt to provide automated reports through the use of information systems. Okay, so the medical staff can process laboratory results for the approval of the physician. This means that results are generated more efficiently, which translate to improve the patient experience. So dati po, you cannot get cardiology report kapag wala po yung physician. However, nowadays, since nasa HIS naman, and then si doc lang po ang pwede mag-input ng report niya or result niya. Okay? Once na na-input na yan na doc, no, ang kanyang staff or yung secretary niya can now print the result for you. Dili na need na si doc i-manual niya sulat. Nga na siya, guys. No? Mas easier na jud karon. Therefore, making the result, no, to be generated more efficiently. Okay, so meron din tayong mga other na kanang murag under sa HIS, no, the materials management system. So from the term materials, okay, so inventory management system. So this system is a combination of technology, no, both hardware and software, and processes and procedures that oversee the monitoring and maintenance of stock products, whether those products are company assets, raw materials and supplies, or finished products ready to be sent to the vendors or end consumers. Okay, so let's start. Okay, we have the MMMS. Okay, so sa MMS, guys, dito kami usually request ng supply. For example, in the clinical chemistry, this is where we input kung ilan yung need namin i-request. Okay, so usually monthly kami nag-request, depende sa type ng inventory, kung weekly inventory ba yan, monthly inventory, but usually monthly dyan na siya. Okay, so malala ninyo sa HMIS natin, to which since the data is constantly given, ito po yun minsan, no, you are constantly given the materials that you need through this one. Okay, primarily concerned with planning, identifying, purchasing, storing, receiving, and distributing materials. Okay, so as such, automation of inventory or material management is necessary for a hectic health center to streamline the hospital supply chain. Computerized stock management systems include technologies for tracking inventories and devices used each day in the healthcare system. Generally, they utilize barcodes and RFID tags. Okay, so yung RFID po, it means radio frequency identification, no, and refers to a technology whereby digital data encoded in RFID tags or smart labels are captured by a reader via radio waves with precise identification numbers assigned for each inventory object to enable accurate tracking and control. So usually po, guys, no, minsan yung mga stocks na gino-order natin, meron yung sila mga barcodes or RFID. So if the HIS po, no, meron nakadikit dyan na parang barcode reader, pagdating ng stock, scan na lang yan siya and automatic na siya malagay sa HIS or sa MMS, in this case sa MMS, na meron yung stock na yun. Okay, so I hope na nagets po ninyo. So kung titignan natin dito, guys, no, this is an example of a purchase order delivery entry. So sabihin the institution might be ordering something, no, from a certain vendor or certain company. Okay, so in this case, no, the vendor ID is ito, name ng vendor is ito, dito daw siya pa-deliver. So, sabihin, mura kang nag-order online, pero integrated siya sa imuhang MMS. And automatically, pagdating ng stocks, nalagay na po siya sa imuhang MMS. Okay, so let's say, for example, you ordered 4 boxes of, let's say, syringe. Okay, so on their end, no, i-scan nila yung mga box ng syringe, and then on your end, sa MMS, once na-deliver na siya, mag-appear na siya agad sa MMS na meron kang ganitong stock. Okay, so remember din, that your MMS has other benefits too. Virtually every healthcare institution has materials management department. So sa amin, ang material management department namin is the purchasing department na siya sa MUA, sa previous workplace na ako, no? That is accountable in receiving the materials, retaining central stock, and delivering supplies within the institution. So sa mo adjud ano jud ni siya guys katong amo ang purchasing. Typically this is where the responsibility of materials management department ends. Okay, an inspection of a nursing unit suite for or exam floor will reveal a smaller or self-managed inventory in supply closets, nurse station, and individual room. These inventories are essential in maintaining supplies conveniently available for use. So, yung MMS natin can assist the healthcare institution in figuring out if the merchandise has been recalled or damaged, able to isolate drugs and devices in case of shortage occurs, responsible in receiving materials retaining central stock within the institution or company. So, tingnan natin ito siya guys. For example, no, we have the multi-store pharmacy system. So, this is yung MMS niya. As you can see, no, that we have tawag yan, merong mga stocks na gi-return, no? Ang drug name is the Kofol. Number of packs, okay, 10 packs. Quantity per pack, so 10. So, ibig sabihin, 10 times 10, 100 tablets lahat, which is this one. Total quantity is this one. So, ibig sabihin, ito mga reasons for return dito na mga, tawag yan, mga gamit, ibig sabihin po, wala siya nagamit. Murag gikuha siya sa pharmacy pero wala siya nagamit ng let's say ng patient or ng nurse, so manang gibalik siya. Okay? So gina-input yun na siya. Okay? So we also have this one, no, na kung saan nag-inventory sila ng suture pack. Okay? So this one is tinitingnan nila kung ilan pa yung meron, no? Then gina-take into account kung kano ang expiration date, tanan-tanan guys. Okay? And then saan siya nakalagay yung suture pack. So in this case, this was in the office po siya nakalagay. Okay, so ang MMS po, it will take record all the data instead of you manually sulat, no, manually writing it down. So yun na, click na lang ka. For example sa chem, ang mga reagents dyan sa chem, click na lang niyo, pila pa ka box ang naiwan. For example, pila pa box of glucose reagent ang naiwan for this week. This week. And then, makikita na yun ng purchasing officer. Then, pag makita niya na, ay, kulang na. So, magtawag na yun sa laboratory. Kausapin niya section head ng chem. Mag-request na ba tayo? Ganito, ganyan. So, automatic na siya, guys. Okay? So, let's talk about the management reporting. Okay? So, today, management reporting is not limited to data retrieval anymore. It has become a platform for reporting and controlling information valuable to the institution. So, recent technological advancements help management reports to provide a non-monetary information which enables the management to have an oversight of its operation. In the same way, these advancements pave the way for emergence of management reporting system. These systems captures the necessary data required by management to operate more efficiently. With this, remember guys that data redundancy and data quality issues are minimized. So, yun naman yung gusto natin, diba? That the data should be kanang good quality jud talaga. Okay? So, some of the data that can be retrieved from the system, no? The employee head count, customer account information, the funding, overall performance of some of the data that can be retrieved po dito. Thus, a good management reporting system enhances the capability of the institution to be more responsive, efficient, and effective in decision making, which affect the performance of the institution as a whole. These systems offers a single holistic view which highlights high value sources and eradicate the lack of visibility in reviewing the performance of the institution. So, ibig sabihin guys, no, ang management reporting po is kanang mura siya in a hospital man good. Okay? In a hospital, di ba sabi ko kanina, marami tayong mga different departments. Okay? So, dati actually, data retrieval lang dyan siya, management report. Ngayon, kay per department, no, gina-check ilan yung mga, let's say, for example, sa amin, pathology man tayo, di ba? Under pathology tayo. Ang pathology department, guys, pathology, radiology, dati sa workplace ko, radiology, yung pharmacy, ito na mga department, under na sila sa isa ka department, the ancillary department. So, si ancillary, siya ang oversee nitong lahat. So, ibig sabihin, meron siyang data kung ilan lahat yung mga under sa pathology department, ilan lahat yung mga rad tech sa radiology, pharmacy, and so on. Lahi po na area ang sa nurses kasi obviously, they are much more in number. Okay, so lahi po nilang data, lahi po ang mga makita nila dito. Makita po nila dira kung ilan yung nag-gross na nakuha ay na-generate na income ng laboratory, na-generate na income ng radiology and pharmacy. So that's why we have a general idea kung sino ang pinaka-income generating in a hospital. Okay, and one of it, top 5 jud always ang lab, kasali jud ang lab sa pinaka-income generating sa hospital. So isa po yan sa mga makikita po dyan. Okay? If merong concern per department, usually yung, di ba meron man yan sa mga OPD, meron yung mga, if may concern ang patient sa ganitong isulat niya. So lahat yun siya matali po dito, makitaan po dito as their overall performance. So usually, at the end of that day, kung walang problem with the department, no, ano man po na nila, recognize po nila. That's why in the US, there are some hospitals who give award sa mga tao. And how do they know kanang sino yung mabigyan ng award? Through the management reporting po. Okay? So, let's talk about the last topic, the inbuilt tally interface. So, the tally ERP9 or Enterprise Resource Planning. Okay? Ito siya guys, mo na ginagamit sa tag-iya sa hospital. Okay? Mo na ginagamit sa tag-iya sa hospital. Okay? It is a process used by companies to manage and integrate the important parts of the business. Many enterprise resource planning software applications exist to help companies implement resource planning by integrating all the process it needs to run a company with a single system. So, kung tag-iya ka sa hospital, usually you will use the inbuilt tally interface. And syempre, sa kadagan mo ginahuna-una, dapat it should be, yes, easy to manage, no? Easy to understand the system. Okay, so easy to learn and can be implemented with minimum resources, used by over 1 million entities in the world. So these are the top benefits of your ERP software. So I hope you can take a gander of this one, okay, before we end our lecture. Okay, so thank you so much everyone for listening to my HIS lecture and the last topic for midterms. I wish you all good luck for the for your midterm examination. Okay, best of luck my dear students and God bless everyone. Bye-bye.